First Lady Chirlane McCray is at the helm of the city's mental health initiative, the ThriveNYC program, started in 2015.
All of Thrive is really focused on the seriously mentally ill.
But the New York City Council has been trying unsuccessfully to find out how well Thrive's far-flung initiatives are focused.
Who collects the data for Thrive?
And exactly how Thrive is spending your taxpayer dollars.
We're talking about people here, not numbers. It is a challenge to measure the relief of anguish and suffering on a spreadsheet.
But the spreadsheet has some big numbers. Thrive's budget, according to a breakdown the First Lady's office sent, is $234 million for this fiscal year and $248 million for 2020. But the totals on Thrive's website are different. The city comptroller is also asking some questions.
If you don't have metrics or a standard by which to measure success, then say it.
Pix 11 wanted to know where all the money is going and how it's being spent to address mental health issues for millions of New Yorkers. According to Thrive, every year, 20% of adult New Yorkers are likely to be diagnosed with a mental health disorder. So we filed Freedom of Information requests with more than a dozen city agencies. We asked for annual budgets and itemized expenditures for the 59 programs under Thrive's umbrella, all based on a list from First Lady Chirlane McCray's office. The initial response? Silence. After 2 months of delays, we contacted each agency and the First Lady's office to ask what was going on. All of a sudden, the answers started coming in. It is not what we expected. McCray's office actually gave us a smaller number of programs under Thrive's umbrella, 37, down from 59, and cites program changes between this fiscal year and the next. And while a number of agencies did respond to our latest round of inquiries, most failed to include itemized expenditures, and the budget from McCray's office did not include any expenditures at all. More troubling, we learned some of Thrive's programs get outside funding, meaning Thrive can't be on top of all of the city's mental health spending.
Making mental health services accessible.
Make no mistake, McCray's husband, Mayor Bill de Blasio, is trumpeting the city's mental health efforts and mentioned them when he announced his run for president last week. But with accessibility comes accountability.
We want to make sure that the public understands what we're spending money on.
In explaining the delay in getting back to us with Thrive's expenditure and budget information, McCray's office cited the high number of Freedom of Information requests. Complicating our quest for transparency is that Thrive's programs are embedded into over a dozen agencies, as McCray's office puts it. And her office says tracking individual expenditures per program is time-intensive and usually reconciled at the end of a fiscal year. The bottom line, it's been 2 months and we still do not have full transparency from Thrive. Some of its programs existed before Thrive did. Others get outside funding, and several actually merge Thrive money with outside funds. It all adds up to Thrive not having full control or up-to-date records of its own expenditures. Corey, Tamsin?
All right.